Hi, everyone. Welcome to GRATITUESDAY. My name is Raina, and I'm a recovery coach here at Capital Recovery Center. So last week, we started an article called How to Practice Self-Care in Recovery. And this article was from a Haley Schaefer. And I don't know where it was published through, but we started out talking about like what self-care is, why it's important in recovery, how it can help prevent a relapse. Also, like the types of self-care in recovery, which were practical self-care, and my fingers were physical self-care, emotional self-care, mental self-care, spiritual self-care, and social self-care, and then professional self-care. So we went over all of those last week, and today we're going to move on how to actually practice self-care in recovery. So it starts by saying recovery is a great time to begin a self-care routine because many people struggle with increased urges when they have too much unstructured downtime. Start off with a few small changes to your routine and gradually add to them as you get accustomed. This way you can avoid setting yourself up for failure. And we've talked about this before, like we don't want to overwhelm ourselves, right? Because we don't want to feel like it's just too much and we throw our hands up. We want to make this obtainable. So starting off very small is always better than just jumping head first right in, because it can be a lot. You know, we do recommend that you find some structure in your life to help with your recovery. It's really great for people in recovery to have some sort of structure, because then we feel like we have like a purpose, right? We know what we're going to be doing, and we know like what we need to do to stay in recovery and stay clean. Because if you think about it, when we were using, we had a routine. It wasn't, a healthy routine, but we had one. It was wake up, find money, find drugs or alcohol, use drugs or alcohol, start process over again. So now in recovery, we have to find a new routine. And part of that new routine really should involve self-care. So here's some general tips on how to begin a new self-care routine in recovery. Identify problems and set a goal. Identify the specific benefits you want to see from your self-care routine, such as less stress, more energy, feeling more in control of your life. So it's always great, to like look at these different steps and write them down. Write down a plan. Something that, is in front of you, something that's tangible, something that, you can read, you can touch, you can rewrite, you can adjust. So, figure out which things are important to you, what you want to see from your self-care. I'm sure for all of us, less stress is great. That's beneficial to everyone. Having more energy, feeling better about yourself, figure out what things you're lacking and that you want to improve on, and write those things down so you can start to figure out how to address them. And then you want to brainstorm self-care solutions and remedies for your problem. Make a list of any and all self-care activities you think might provide you with these specific benefits. So again, pick one, right? So let's say that we want more energy. What are some things that we can do to find, more energy for ourselves? Those things can be like setting a sleep schedule, doing things such as eating better, going to the gym 3 times a week, or even just, get home from work, take a walk around your neighborhood just to get that blood pumping, especially if you're someone who works in an office like I do, that sedentary lifestyle, it kind of drains you, so it's good to get up, or on your lunch break, go for a walk. Anything that, you think might help with that goal. It's good to write out what the goal is and then write out different things to be able to obtain it. So then next, you want to pick 1 or 2 activities from your list to start. Be selective and choose 1 or 2 self-care activities, ideally the lowest cost and the highest reward options. So recently I was speaking with someone and I called them on their lunch break and they were going for a walk. And, they said that, now every day on their lunch break at 12 o'clock, they get up from their office, even if, there's emails that need to be answered or, paperwork that needs to be filed at 12 o'clock. She gets up, she goes for a walk. She comes back to the office and she continues to do the things that she needs to do. But just having that one event scheduled every day to get out of the office, get some fresh air, step away from any stress you might have going on, that small step creates a routine to eventually, be able to have less stress, more energy, etc. So commit to consistent self-care routine, committing to doing these self-care activities consistently for at least a week, every day if possible, so you can see whether they're providing the benefits you want. Again, she found a routine and she is committed to that routine and she's already finding the benefits of it. So this is something that I lack. my self-care routine really is on a day-to-day basis of what I need to do, whether that means to lay down or, to go for a walk or whatever the case may be. This, self-care routine is so much more beneficial. And that's one of the things that, are in my list to work on is to set up that routine. And listen, life shows up. You may have that day where you just can't do it. It's okay. You don't give up. Don't throw it out the window. Next day, start it all over again. Track self-care benefits and assess progress toward your goal. Keep a simple daily log or journal to track any benefits you notice. And after you have a week's worth of data, set aside time to evaluate whether this self-care activity is providing you with the benefits you need or not. And that's great because you know what? You might find that, for the example of, going for a walk on your lunch, you might find that that's just not something that you're able to do consistently. Depending on the job you have, depending on where you work, you know what I mean? Sometimes we don't work in places where there's really anywhere to walk. If you work, in a factory, there might not be anywhere to go. If you're in an industrial park or if you work in a building on the 5th floor, maybe your exercise can just be walking up and down the steps. I don't know. But, sometimes certain things just we find aren't beneficial to us. And that's okay. It's okay if it doesn't work. Just don't give up. Try something new. So, and that's what this next part says. Adjust your self-care routine as needed. After evaluating your new self-care routine, you will have the data you need to determine what adjustments to make, what parts of your self-care routine to keep, and which to ditch or change. This is also the time when you can add one or two more routines to test out for a week. That walk doesn't work on your lunch break. It's too much time or it's getting hot out. You don't want to go back to work sweaty. There's different things to take into consideration. So maybe you try doing that walk at the end of your day when you're going home. So you have to worry, come back to the office, having to put deodorant back on or whatever the case may be. Maybe you find that just the heat isn't good for you. I'm somebody that, when it's really hot out, it's hard for me. And when it's really cold out, things are hard for me. My bones don't work right, just different things. So, you might find that, at certain times of the year, that walk is perfect for you. And other times you have to adjust and find something else that's going to work for that period of time. Again, it's okay. You change things up, do things differently, try new things, hey, try something that, you used to do a long time ago. Oh, this worked for me at this point in time. Let's try it now. Maybe it'll help now. Because things change. We change. Our bodies change, whether we want them to or not. We get older, we might, get sick, whatever the case may be. Adjust. And that's really important to be able to do, especially in recovery. We have to know that just because something isn't working, it's not the end. It just means that wasn't working. We just have to find something else that does. And I feel that sometimes for a lot of us, we want what we want it now. We want to see immediate results. And when something doesn't work, we get frustrated and we say, forget it, and throw our hands up. We have to break out of that routine and out of that mindset. And trying these little self-care things can really help as long as you don't give up. That's the most important thing, is just don't give up. Over time, following this process of trial and error helps you identify an effective self-care plan that's specifically tailored to your recovery needs and goals. Remember that being consistent with your new routines is the most important part, as you're unlikely to see substantial benefits from sporadic and occasional self-care. This is what I am guilty of. I go to the gym one day, 1 week, I go 2 days, another week. I don't go at all the following week, and I wonder why I'm not seeing any results. I'm not being consistent. I'm not going to. So like, and I'm one of those people that I'm just like, what? I haven't lost 20 pounds in 2 weeks. Forget it. You know what I mean? Like, we want those results now. And so that's something that I need to work on still. You know, after all this time in recovery, you know, just because we get some time behind us doesn't mean that we have it all figured out. You know, sometimes, you know, we have to kind of fall and get back up again, even when it comes to things like this. So just remember, like, it's being consistent is important. And I don't know if you guys ever have been involved in a 12-step program, but they always say 90 meetings in 90 days. And there's a reason for that. Because that 90-day period is what it takes to make something a habit, to make something a routine. So, you know, start out, how this article is talking about, just start out with 1 week. You know, see how far you get with that 1 week, and then do it another week and do it another week. And before you know it, it's just become part of your daily routine without even thinking about it. So finding ways to keep yourself motivated and on track is important. Over time, these self-care routines will become habits that take less effort and energy to stick to. And, you know, that's what is important. We want to stay motivated. So find something that will keep you motivated to stay on this track. You know, I don't know if you're like, I always go back to like when my kids were young and like having them learn responsibility and, you know, to do things for themselves, to gain some independence. And like, you know, I do the sticker method, you know, I'll buy a pack of stickers that this one likes or this one likes. And every time they do like their, whatever it is that they are, like laundry, you know, I wanted to teach them how to do their own laundry. So every time I would go down with them, show them how to do it. And eventually they would do it on their own and they would get rewarded for that, because it's showing that they are consistent and they are taking the time and effort to learn how to do something for themselves that they're going to have to use throughout the rest of their lives. So find a reward system. You know what I mean? If you are someone that enjoys sweets, you know, treat yourself with something at the end of the week if you've done, like, if you ate well all week. Or, you know, if you're someone that, you know, clothes, whatever the case may be, don't go crazy. But, you know, find something to reward yourself. So let's talk about how self-care changes in different stages of recovery. So recovery from addiction is a long-term process. You know, that long-term process, it's never over. You know, we are always every day learning and moving forward and developing coping skills and strategies for self-care. So this process is ongoing, and it's great because you want to be able to grow and evolve. So in each stage of recovery, you might find that you have different issues and needs that require different kinds of self-care. For example, early remission from addiction tends to be a stressful phase and is also a time with a high risk of relapse. Because of this, you might need more intensive and structured self-care routines to support you. And that's very true. When we first come into recovery, we're in this very volatile state. And, you know, we need a lot of support. We need a lot of direction. You know, and we need different things that we can turn to in times where we might have cravings or we're being triggered or any other thing that might lead us back to something and cause a relapse. So it's really important that you try and stay focused. And honestly, it's when we have the most free time on our hands as well. For a lot of us, we don't come into recovery with a job or a license, or probably don't have much money, if any, all these different things. And we have to learn how to fill our day with something that, instead of using, because that routine of getting up, finding money, finding the drugs and alcohol, using the drugs and alcohol, that was our daily routine. That was our life, and it filled our day. So now here we are looking for other things to fill our day, other things positive to fill our day, other things supportive of our recovery to fill our day. So, starting to put in self-care routines might seem a bit overwhelming, but again, it's about starting out small. Just find, something small that you can look forward to every day, or that you can put into practice every day. Even if in the beginning it's, going to a 12-step meeting, going to church every week, calling somebody. If you have supportive parents, calling your parents, visiting your parents, finding people who are also trying to recover, coming here, calling us, just to get out of yourself during the day. You're always welcome. Just come in here and talk to us, just to kind of keep your head where it needs to be and keep focused. Any of these little things that we need to start finding to help us build a more structured life and a more productive life. So after the 90-day mark, you pass into a more stable phase of recovery. In this phase, you can often relax some of your self-care routines, step down to less intensive kinds of treatment, and resume a more normal routine. Again, 90 days, right? We just said 90 days to create a habit, which in recovery, 90 days in, you haven't used for 90 days. You've just created a habit of not using, which seems a little crazy, but it really does, help keep you on the right track. And if you can get through those first 90 days, I'm telling you, you can get through anything. And we don't have to kind of be so infused in everything. We can look for that next step, see what we can add to our routine, see what may not be working in our routine anymore. When I came into recovery, I was sleeping on my mom's couch, and it was not easy for me. I hadn't lived with my mother since I was 16 years old, and here I was back on her couch. So for a lot of that first 90 days or so, my life was about going to an IOP program. It was about going to 12-step meetings. It was about, surrounding myself with people in recovery. And in home, it's her home. So there wasn't really much for me to do there. But after that 90 days, I started to feel better. I started to feel more productive. So I was able to contribute more. I was able to go back to work a couple days a week. I was able to contribute in her house if she needed me to do something for her, do the dishes or get dinner started, whatever the case may be. I started to add those things to help her as she had helped me. So, everything is up for revision. So don't feel like, oh, this is all I have. This is all there is. There is more. You just have to keep going and see those adjustments and see those growths. So your risk of relapse remains moderate in this period. So it's still important to make time for regular self-care. After about a year of sobriety, you reach the stage of sustained remission from addiction and will probably need less structure and support to maintain your recovery. Again, it changes. And this is really on a case-by-case basis. Some of us at a year, we still need just as much support as we did at 30 days. And that's okay. Others, it's, they can kind of bounce back a little quicker, and that's okay. The important part is to not compare yourself with someone else. Always compare yourself with yourself, because when you're at a year and you're feeling like you're still stuck and you haven't made progress, go back, go back and look at that list that you made of something that you wanted to change, something that you wanted to add to your self-care routine. Have you been doing it? Have you grown from it? Has it gotten easier? Has it become beneficial? And 9 times out of 10, if you're, working your recovery, you're going to see your own growth. And that's what's important, your own growth. So next we're going to talk about didn't we just do that? We did. What to do when self-care isn't enough. First of all, don't give up. I'm going to keep saying that through this whole thing. Just don't give up. Because addiction isn't just a stress-related disease, i.e. genetics, neurological factors, trauma, all these things can be predisposed to you. Self-care usually isn't sufficient to treat or cure an addictive disorder. And listen, I'm not ever gonna let you tell you that self-care is gonna be all you need. There are different things in recovery that you need to do to help sustain your recovery, to help you grow in your recovery. This is just one of those things. Luckily, a number of effective treatments for addiction exist and can help address the underlying causes and complications of substance use disorder. According to research, people who seek out professional treatment for their addiction are more likely to remain drug and alcohol free, especially if they stay in treatment for a year or longer. So when a lot of times we talk in here about the many pathways to recovery, and that pathway is going to look different for everyone. Your path is not going to be the same as the person sitting next to you. Again, it's okay. It's different for everyone because people are different. For me, it was, detox. It was a inpatient, oh my goodness, I'm losing track of my mind. It was, going to a psych unit for a while. It was outpatient therapy and group therapy and drug therapy and all these different aspects, where for someone else, it could have just been detox home, I'm good. They might do 12-step or faith-based help or, just other people in recovery. My path was my path. And others, it looks like maintenance, like Suboxone or methadone. It could be just general counseling, grief counseling. There are just so many different things that we have at our fingertips to help us in support in our recovery. And if there's ever a time that you don't know what to do or what support is out there, call us, because we have so many resources to help you in whatever pathway you decide that you want to travel. So the last part we're going to talk about is seeking professional help for addiction treatment. And many of us, this is how our path starts, right? So we look for doctors, we look for detox, we look for inpatient rehab, we look for therapists, we look for these professionals to help us along our path. And they can be such a great support system for you. I still, after almost 6 years of being in recovery, I still see my same therapist that I saw when I came home from day one. He is still an important part of my recovery pathway. So there are a number of different addiction treatments that can help people struggling with different kinds of addiction. Depending on the type and severity of addiction you have, certain treatments may be more effective than others. Often people begin the recovery process at a more intensive level of addiction treatment, like inpatient rehab or intensive outpatient addiction treatment centers, and then step down to lower levels of care as they make progress. And that's something that we always recommend, like continue the process. Go to detox, start to feel better physically, and then continue with inpatient rehab. Then you can start to work on things emotionally, mentally. Come out, do an outpatient program, connect with other people in your area in those groups. A lot of people that we talk to, they make friends and support systems with the other people in their outpatient programs. Then you could, do something as like coming and joining our meetings here at the center. You could do the 12-step programs. You can do the faith-based programs. There are so many different options out there for you to continue along a pathway. So here are some effective addiction treatments to explore. Medically monitored detox, 24-hour medical facilities or hospitals that provide medical monitoring and interventions to help people safely detox and withdraw from substances. This should really be your first point of contact. We're going to talk about medicated assisted treatment in this section as well. For some people, that's their first point of contact. So either way, whatever's going to work for you, one of those is really where you want to start out so that we can start flushing all those toxins from the drugs and alcohol out of our bodies so we can start to think more clearly. The next is the inpatient rehab, which facilities that offer 24-hour overnight treatment that provide intensive treatment, group therapy, recovery skills groups, and individual and therapy and family therapy. This is where you can start to really get an idea of what recovery entails. A lot of times they bring in people from the outside to share their stories with you. People that may have graduated that facility or now alumni will come back in and, tell you, their story and how, going through inpatient treatment changed their lives and helped them, continue in recovery. It just starts to give you that foundation that you need to to sustain recovery when you come home from the inpatient program. The next one is the intensive outpatient treatment. And this usually involves going to a clinic 3 to 5 days a week for group and individual therapy appointments that focus on addiction recovery. Again, this is where I hear a lot of people say that they meet their support, they meet their friends and other people in recovery who are doing the same things that they're doing, and then they start to be able to open up because a lot of us are very closed off. And going to a group setting in an outpatient program helps you start to open up and realize that you're not alone. There are other people out there who are struggling with the same things as you and are there for the same reasons as you. So this is a great way to start to feel comfortable talking about your addiction and your recovery. Next is the outpatient treatment, and this is for addiction includes individual, group, or family therapy appointments that happen 1 to 2 times per week in an office setting. And a lot of the intensive outpatient treatment services have a step down process. So you could start out going 3 to 5, and then by the time you're looking to graduate the program, you're going once or twice a week. And you're seeing someone on a one-to-one basis, which is great because if you aren't comfortable with sharing something in front of a group of people, this is where you have that chance to share it with someone who is, who is licensed or, practices therapy or counseling, and you can feel safe in telling them certain things that you might not feel safe doing in a group setting. The other option is the medicated assisted treatment, and this is an outpatient treatment that includes psychiatric or addiction medicine that can help reduce withdrawals and drug cravings, such as Suboxone, Vivitrol, methadone, any of these options. And, these can be a great support system in conjunction with the outpatient treatment and the one-on-one therapy treatment. They kind of go hand in hand because you want to be able to get to a point where if you're someone for myself, I had post-acute withdrawal very bad. And if you're not familiar with what that is, I had withdrawal symptoms for a couple of months. So they were going to help me with my withdrawal symptoms by, with a medication to help, taper them off. So, for about 30 days, I used that medication, and eventually, my withdrawal symptoms were gone. But it gave me just that wiggle room where I could start to feel comfortable in my own skin, and, mentally and emotionally clear, my head to be able to start working on my recovery. And then recovery and self-help groups. So these are free groups for people recovering from addiction, which are the 12 steps, like AA or NA, smart recovery, faith-based programs, and so on. And these as well are a wonderful place to build that support system. This is one of the paths that I took, and I have a support system that went from being friends, and now they are my family. They are people that I can count on no matter what, and who are there for me legitimately just because they want to be there for me. And you want some of these people in your life in recovery. They literally can help save your life on any given day. And it's so important to have a good support system. And this is a great place to find one, especially if you're someone who doesn't really have the family support, or you come into recovery and you find that, you don't really have anybody who wasn't involved in your using life. This is a great way to find those people that can be supportive of you and your process. So the best way to determine which treatment option will best suit your recovery needs is to make an intake appointment with a therapist or provider who specializes in addiction treatment. Call us. It's what we do. We will find a program that works for you. We will talk to you, find out what your needs are, find out what your preferences are, and we can help you, find that initial place to go to start your path of recovery. And they can help clarify, they can help conduct a substance evaluation, like I just said, clarify any diagnosis and recommend individualized treatment options. Most people begin their search for a provider online and setting up an appointment with an addiction specialist. Again, you are always welcome to go online, research these things for yourself. I always say, like, if you want to know what our resources is, where we get our resources, you can Google some of the places. You can look at reviews. You can see what what they recommend, how their process works, how their detox and inpatient processes work. But listen, like, if you need anything to help you on this path, to help get started, to help sustain, that's what we are here for. We love for you to come in and join us for some of these meetings. Just to talk to us, whatever you need. We are people who are in recovery as well. So every day we are doing something for our recovery too. It's self-care. That's a big part of it. It can be therapy, like me personally. There are just so many different things that we have experience with that we can help you because we've been there. We understand. So please feel free to give us a call or stop in and talk to us. The Gratitude Tuesday is a great way to practice self-care. We talk about gratitude here a lot, of course. So like making a daily gratitude list, journaling at the end of the night about how your day went to like kind of decompress and put you in a better mindset, or in the morning to help get your day going. All these little different things that can help play a part in your self-care process to help you sustain recovery and, be successful in recovery, because that's what we want, right? We want to be successful people in recovery, and that's what we want for you. So again, thank you for joining me today on Gratituesday. And as always, please come in and join our groups in person or online, and we will see you next time.